Welcome back to WSAV News 3 today at 11. West Nile virus is the leading cause of disease spread by mosquitoes in the contiguous United States. Now, recently, the Georgia Department of Public Health confirmed that the first human case in the Coastal Health District was reported, making it the second confirmed human case in Georgia this year to date. Dr. Bonzo Reddick is the director of the Coastal Health District. He joins us now with more. Thank you so much for being here today.
Thank you for having me again. Thank you.
First off, let's talk about West Nile, because we know that an individual in Chatham County tested positive for the virus. What does that mean?
Sure. So there's a couple distinctions that need to be made. So many people get exposed to the West Nile virus. The majority of people, probably 80% of people, don't have any symptoms. They don't really get sick. Smaller percentage actually get sick from it. And that's when we talk about having a human case of West Nile virus.
Okay. How is it transmitted?
Through mosquitoes.
Yeah.
So it's what we call,
which we have a lot of
we
around
have a lot of in the
yeah.
Coastal Health District. And during this time of year in particular, the highest months that we see every year in West Nile virus in our area are in August and September. So we're right in the middle of it right now. And so it's spread through mosquito bites. And it's what we call an arbovirus. So these are a group of diseases that are spread by the bites of mosquitoes.
We mentioned, or you mentioned just a few moments ago, that 80% of the people who are exposed do not have any symptoms, do not get sick, but what about the 20%? What happens?
Sure, so they have kind of flu-like symptoms. They often have fevers, what we call myalgias, which are just muscle aches, often have headaches along with that. And that's the majority of the people who get symptomatic or get sick. There's also a small percentage, not very many, about 1%, that really, really get sick, and they have brain inflammation. It's a disease called encephalitis. So that's the most severe form of it. But for most people, it's just really bad fevers, myalgias. You feel like you have a terrible flu for several days.
So we know that it's transmitted through mosquito bites, but how do the mosquitoes get it?
Sure. So there's a lot of things that we don't quite know where they started from, like where did malaria ever start from?
Yeah.
Where was the origin of it? Who knows? But that's how it's spread. And the important distinction is that it's not spread from person to person.
Okay.
So if you happen to be around somebody, or you find out that the person, if it leaks out somehow that who the person is and you were near them, it's not anything that the general population needs to be worried about. The mosquitoes they need to be worried about.
The mosquitoes, and there are certain times of the day that you're more exposed to these mosquitoes. Let's address that.
Yeah, so on the Department of Public Health and our Coastal Health District's website, we often talk about preventing these diseases, because that's the most important thing. There's no cure for West Nile virus, so you really have to work on prevention. And so we talk about the 5 Ds, and so dusk and dawn are part of the Ds as well, the time of day. So early in the morning when the sun's first coming up, and nighttime when the sun's setting, that's when the mosquitoes are really out, and that's when you're most at risk.
Okay, and also dress is one of those Ds.
Absolutely, long sleeves. I know it's really hot outside, so nobody wants to wear long sleeves, but if you have to be out during those times where there's lots of mosquitoes, wearing kind of really light, loose-fitting long sleeves helps.
DEET, that's very important.
DEET is very important, and DEET sometimes gets a bad rap, but DEET is a really, really effective way of preventing mosquitoes from biting you. That's what's present in things like OFF, or some of the different brands you'll see. Now, there are some people who don't like DEET because really, really high levels on really, really, really small people can cause some nervous system side effects. Very rare, only in really, really tiny people at large amounts, but for people who don't feel comfortable with DEET, picaridin or oil of lemon, eucalyptus, there's a lot of different things that work well, but make sure you're using an evidence-based way to prevent mosquito bites.
Okay, here's something very important, especially this time of year: drain, because there is water everywhere because of all of this rain.
Yes, mosquitoes love just sitting water, right? So if you have plants around your house, you have flower pots in particular, that's a place they love to collect. Or if you happen to have like areas of your sidewalk or driveway where it's kind of sunken in and you see water sitting, taking some kind of device, some way to kind of get that water removed, tipping over your flower pots, but just not letting water sit there standing.
Doors.
Yeah, so if you look at most places, that's a place where like a lot of bugs can sneak into houses, right? Like little cracks and things like that. And so weather stripping updates or different things that you do to prevent things from getting to your house. Okay. But preventing those mosquito bites is number one. That's the most important thing.
Okay, so you mentioned that there is no cure, but what about treatment? Because right now we were talking if there's some sort of vaccine that can prevent this, and right now.
Yeah, unfortunately, right now, no vaccine in the works, at least not anything anywhere close right now. And treatment, there's no real cure for West Nile virus, so it's really supportive treatment. So if someone does catch a human case of West Nile virus, we're really just trying to make sure their blood pressure stays up, that they don't have seizures, if they have the brain inflammation, things like that. but there's no real cure for it. You really, have to take your chances. So that's why we tell people prevention is the most important thing. My cliche, the ounce of prevention worth a pound of cure. Doctors always say that, but it's so real when it comes to things like West Nile virus.
Now, so far we've seen 2 cases in Georgia, 1 in Chatham County. Last year, 18 cases in Georgia.
So I was just talking to a colleague about this yesterday. So overall, the numbers we're seeing right now are actually lower than our typical 5-year average. We kind of look at 5-year chunks to see what the trends are, and so we're actually quite below our 5-year average. But I don't want to give people a false sense of security. To me, West Nile virus and preventing mosquito bites is kind of like seatbelts. Okay. Most of us have never been in an accident where if we didn't have our seatbelt on, it would have caused us to lose our life. But you still put that seatbelt on every single time you get in a car because all it takes is one time. Yeah. So most people won't get sick from West Nile virus if you kind of risk it and go out there. But all it takes is that one time you get the wrong mosquito in the wrong situation, and you can. And certain people are at higher risk than others as well.
Okay, and a final word to our viewers about West Nile and being safe when it comes to exposure and getting this disease.
The main thing is you're going to hear about a human case of West Nile virus in our district. Don't panic.
Yes.
The most important thing is just to prevent mosquito bites. Using DEET, long sleeve clothing, trying to stay away during those times of day where mosquitoes are really out, and that's the best thing you can do.
And if you feel funny,
go see your healthcare provider immediately.
All right. Thank you so much, Dr. Bonzo-Reddick. We appreciate you being here. And if you'd like to see this information again or view this interview anytime, you just visit our website, wsav.com/community corner. We'll get him back on to talk about some other things. Not that we have him in the future. We appreciate your time.
Thank you very much.
Stay with us. We'll be right back.